Governments are ramping up their moves to contain the coronavirus as it spreads globally. Japan is among those governments. Prime Minister Shinzo Abe has called for all public schools to close from next Monday until the end of spring break in April. This as new infections of the virus outside China outnumber those in China. Let's take a look at a map that shows the severity of the situation in the affected nations. Now, the deeper blue the country here, the larger the number of reported cases. And as you can see, China still has the highest number of cases, more than 78,000. Altogether, 50 countries or territories have confirmed cases of the virus. The total stands at more than 82,000. Now, South Korea has again seen its biggest one-day jump in infections, and Saudi Arabia has stopped travel to religious pilgrimage sites due to fears over the virus. In Europe, Italy's outbreak has worsened, while Romania, Denmark, and Estonia are the latest countries to confirm cases. And Australia is taking emergency measures to stop the disease from spreading. Numerous international flights have been cut back or canceled. Here's a closer look at how countries around the world are fighting to ward off a pandemic.
Streets deserted as infections surge in Italy. Several new cases across Europe. More deaths reported in South Korea. And many global events, from sporting matches to conferences, cancelled. Around the world, preparations are ramping up as fears of the virus turning into a pandemic grow. Australia has kicked off emergency measures.
While the WHO is yet to declare the nature of the coronavirus and its move towards a pandemic phase, we believe that the risk of a global pandemic is very much upon us, and as a result, as a government, we need to take the steps necessary to prepare for such a pandemic.
As the number of cases in the Middle East rise, travel to holy sites in Saudi Arabia has been halted months in advance of the annual Hajj pilgrimage. Even North Korea, yet to report a single case, is taking preventative measures, closing its borders and postponing the new school term. The virus's epicenter in Wuhan in China remains the worst hit. Most of the reported deaths and cases are in the city and the surrounding Hubei province. But as China's infection rates slow, the virus is now spreading faster elsewhere. More and more countries are reporting cases and upping their efforts to contain outbreaks.
We can speak now to Christian Lindmeier. He's a spokesman for the World Health Organization, and he joins us from Geneva. Christian, good to have you here on DW. This outbreak is now global. It has affected nearly every continent, 82,000 cases. Where does your organization, the WHO, put its focus in tackling this outbreak?
Prime focuses. The one is, of course, in China, the source of the outbreak, as we know. Here, as the report also said, we have actually good news. That means we have declining cases, and we have less, for the second time in a row now, less cases inside China than outside China. The flip side of that coin is exactly the other side, that we have now more cases outside of China than we have inside China, which is our second priority to look at. And we have been calling, the World Health Organization has been calling upon the countries of the world since weeks to vamp up their response and to prepare for exactly that scenario. And preparing means a lot. Preparing means getting your health system ready, getting your healthcare workers ready and protect them, because these are the first who would normally have to field any sick patient or any patient with symptoms. So we need, the countries of the world need to protect their healthcare workers. That's step one. The second is preparing or protecting the vulnerable population. That's the patients with underlying conditions or the elderly, the weak. And third, of course, it needs a lot of information and helping those countries who are not as strong in responding to this outbreak.
Christian, I want to ask you about that flip side, because this is extremely worrying. I mean, why are we seeing this spread in infections to places where there doesn't appear to be a direct link to the epicenter in China?
It's a good point, in which we still have to understand more. So most and the vast majority of all infections come from symptomatic people and from those who we can trace back the link. But it seems, or we still have to understand more about how possibly asymptomatic people have been transporting the virus and then have been showing up in countries or infecting others without a direct link yet back to the origin. So these tests and these looking into history of travelers, of infection history is ongoing, because we need to understand that, how these infections are possible, how they come about, if there is a link or if there's no link, and if there's no link, where these infections come from.
Okay, we are seeing people-to-people transmission, of course. We are seeing deaths from these cases. Should this be declared a pandemic? I mean, what would that provide your organization?
So the World Health Organization has already rang the highest alert that is possible in our system. That is declaration of a public health emergency of international concern. This is a mechanism which was declared already a month ago. Pandemic would mean that the outbreak has reached levels where it's in multiple countries outside of the origin, not containable, or widespread community transmission. So we believe we haven't seen this yet. We have seen many countries being hit by the virus, that is for sure. But most of these countries still have a good grip on these individual outbreaks. They contain the people, they contain, they treat the patients, they trace the contacts and trace all the people who have possibly been infected on the way. They quarantine people or instruct them to self-monitor for a while. So as long as this is under control, this is good news. But there's a very high potential, as the colleague also just mentioned, of this reaching pandemic levels. And once it reached it, we will certainly talk in those terms. But let's not make this mistake here. The effort of response is not limited or related to whether we call it a pandemic or not, or whether the world calls it a pandemic or not. The efforts a country can do, the efforts the individual can do, the efforts every health system can do are there yet and will be.
All right, we'll have to leave it there. Christian Lindmeier, spokesman for the World Health Organization. Thank you for joining us.
Thank you.
Now, here in Germany, the government has set up an emergency task force to deal with what the health minister says is the beginning of an epidemic. The country has seen 10 new cases since Tuesday. A couple is being treated at a hospital in Düsseldorf, and schools and kindergartens in their town have been closed while officials try to trace a chain of infection. Health Minister Jens Spahn has urged regional authorities to review their emergency planning.
We're at the beginning of a coronavirus epidemic in Germany. The cases in North Rhine-Westphalia and Baden-Württemberg are a further sign of this. The chains of infection are partly, and this is a new aspect, not traceable. There are multiple persons who have had contact with the infected patients. And that's a qualitative difference to the 16 infectious cases we've already had in Germany, where in each case the chain of infection could be traced back to the outbreak in China.